this is really nice.
Yeah.
Last week they released results for high schoolers. Those who have just completed high school. And right now, most of them are hoping to join universities, colleges, and all these higher institutions. For somebody who's out there who wants to join medical schools, right? You know, we all have myths, right? I can say about that college and all that. What do you have to say to them? Just something. Just tell them something. Something. Just I don't want to say conspiracies. I think myth would be the good one.
Okay.
Because we have things about. I remember before joining, was told, man, med school you have to do this and this, and I mean,
do this,
and right now there are things that. I mean, some of them are not even happening.
Come on.
I'll be like, wait, this is something different. So, is there anything for them?
You don't have to know everything.
Okay.
That's one. You can never know everything.
Of course.
So, you're not there to compete with your classmates.
Okay.
Like, you don't have to prove a point. If you know, you know. If you don't know, accept it. You understand?
Okay.
And nobody's above the other. Don't look at a nurse and be like, that's below me. No, look at a lab technician and be like, nah. Look at a midwife and be like, we are not the same. No, you guys are a team. Yeah. So, in the medical field, you're basically working as a team. Okay. Don't come in with the mentality of hierarchy. Dump it.
Okay. I thought. I mean, really, I thought there were levels. I mean, hierarchy.
There are levels of leadership. You can find a nurse who is your supervisor, who is in charge of the ward, and that's it.
You understand? We met them.
Yeah, so fine. There are levels of leadership, but you have to understand that every profession has their job, like what they're supposed to do.
Of course.
You understand?
Yeah.
So just let everybody do their thing and do yours. But you have to understand and come with the perception of that I'm coming together to work with a midwife, to work with a nurse, to work with the midwife, the lab technician, with the doctor, you're working together for the good of the patient.
Okay. Wow. I remember before coming here, right? One of my friends asked me, and he was like, hey, I heard that you are joining soon, so what are you going to do? And I was like, I become a CO, clinical officer. And he was like, wait, what is a CO? So I know there are a lot of people out there who still don't know exactly what a medical clinical officer is. Yeah. So can you just maybe try to say something about it?
I will. So just as I joined, I didn't know what I was going to do, because my story is long. My story is long, okay? So, but I know now some of the things that clinical officers do.
Okay.
They diagnose patients, they interpret lab results, they prescribe medicines, and then they clerk patients. And they also administer drugs.
Okay.
Some occasions like emergencies and stuff. And some of them, we also participate in the leadership of facilities, like being in charge of a health center, in charge of a hospital. We can participate in that, but I'm not quite sure about participation in the leadership of a hospital. But I think a CEO can be just anyone. So those are the few that I know yet, but it's more to diagnosing, requesting for lab tests and interpreting them, and then clerking, taking history and doing physical exam.
Wow. So how has it been since the day you joined the school? How has it been with you now?
I've changed a lot.
Okay.
I've changed a lot personally. Wow, I really challenged myself since year one. I used to sleep a lot.
Okay.
Like a lot.
I didn't know that. I mean, you never told me.
I used to waste a lot of my time doing things that were really not important. But the the one of the most huge challenges that I've experienced is the transition.
Okay.
Transition from just being a normal person to transitioning into a profession that is prestigious or like
Okay.
talked about, that
Okay.
is noble.
Yeah, yeah,
When
yeah.
you're medical personnel, there are very many expectations that just anybody who knows that you're a medical personnel will be like, okay,
But you were just
this is
like,
supposed to have this, it's supposed to be very smart, it's
man,
supposed to
yeah,
be very
yeah.
this,
You're
organized,
supposed to
clean,
know
and
everything about
exactly.
someone.
You're supposed to just know, you
They
understand.
cough like this. It's just it's TB.
Say, what could this person be? Okay, fine. So, I used to be like, oh, I need to sleep. Come on. But then I realized, no, I want in the near future someone may call you at 3 a.m. and be like, yo, man, we need your help. Do this and that. Now, the transition has
Yeah.
not been easy,
Yeah.
and being a day scholar has made it worse.
Oh.
Staying at home, there's so many distractions like
Wow.
watching TV,
Wow.
caught up in drama around the globe,
Okay.
home, okay. So when I perform, I know I'm bad.
What? Whoa.
I'll be like, I'm the real deal here. So I'm
Wow.
like, how can someone? Okay, that's not for pride.
No, no, no,
I'm
no,
just
no.
trying to make a point.
I mean, yeah, I get it. It's okay. I mean,
I'm trying to make a point.
I'm a day scholar too.
Yeah, I know.
I'm outside.
Yeah.
I'm staying outside. I'm not in the hostels with the rest of the guys.
Maybe I can just target the girl who's in there.
Okay.
Because I get to do some home chores sometimes, like my weekends and stuff. Man, yeah.
Wow. The old story, the old vibe has been really amazing. Trust me. I like this, and I like this. I know. We've talked a lot. Really, we've talked a lot, and we've touched almost everything.
Mm-hmm.
And I know everything that you said come from heart.
Mm-hmm.
Yeah, that's what makes it really nice, and that's what makes it really amazing.
Yeah.
And I know we shall be having more talk, and this is not the only one.
Mm-hmm.
Yeah, that's it.